Hello.
Thank you everyone for your patience. Let's now welcome Mr. Jim Kandidakis.
Good afternoon. Good afternoon, everyone. How are you? Thanks for coming in and sorry for the delay. Today what I want to do is I want to talk about an area that I specialise in and that I spend most of my time talking about and working with and even thinking about, actually, even when I'm sort of sleeping. I don't know if that's a good thing. But what I'm going to do, it is going to be quite gut specific or gastrointestinal specific, but I want you to bear in mind too that a lot of the things that I do say, without the specific effects that it has on the gastrointestinal tract in terms of the mind-body, these sort of principles sort of apply to any problem that we have, because this predominantly affects the rest of this. Okay, but again, I'm trying to provide you with some information and something that's different, and some things that most people don't think about. And we don't really think about our digestive tract or our gut until it starts to play up. Okay, so what I'm going to do, I'm going to start. Oh, actually, what I'll do is I'll tell you a little bit about myself. As says up there, I'm a psychologist and hypnotherapist. I wasn't always a psychologist and hypnotherapist. I began as a radiographer many years ago, and as you can imagine, I saw a lot of people who were quite ill, and I felt quite sort of helpless at not being able to do anything but take pictures of them, essentially. And this led me to sort of actually become a cook, and it wasn't just any cook, it was a macrobiotic cook. And I don't know if anyone knows about macrobiotic. I think Madonna's on that diet. It's supposed to be a healing diet. And when I was working with people and I was teaching people in this sort of form of diet, I was coming, the people that were coming to the school to learn were people that had cancer. And I was also experiencing and noticing that it wasn't only the diet that they needed to work on. It was also their mental attitude and their stress levels, etc. And this got me interested in mind-body medicine. And so, hence, back to university, back to studying and into psychology. So my interest has always been in the mind-body connection. In terms of the gut, I had a very close friend who had Crohn's disease. Does anyone know what Crohn's disease is? Yeah. And I'll talk a little bit about that. And I got to see firsthand what effect that had on her life. And that's what sort of sparked my interest in the brain-gut, okay, or the mind and body aspect of things. So what I want to do is I want to share with you what I've learnt and what I teach and what I do to help people overcome their problems. Okay. So what I'm going to talk about today is I'm going to talk about the brain-gut axis, and a lot of people might not know what this is, so I'll explain it. I'm going to talk about stress and the gut, but a little bit about how stress affects the body as well. The psychological effects that result from problems that we do have with the digestive tract, and it can even be related to other problems that people might have with their body, other aspects of their body. I'm going to talk about the psychological treatment, because that's the area that I focus on and that's the area that I work in. And I'm going to look lastly at environmental factors, and it's a really exciting new area sort of that people are focusing on. Not necessarily so much in the gut, unfortunately, but more so in general health and well-being, and especially the brain. So I'll be talking a bit about that to give you something that you can leave here, maybe with a bit more knowledge, maybe a bit of a reminder of what you already know, something that you can take away that might be useful for you to keep in the back of your mind for your own health and your own well-being. Okay? Okay, the brain-gut axis. The brain and the gut develop from the same clump of tissue when we're embryos. We're tiny little babies, right? From the same clump of tissue, I don't know if you can see my little finger there. And what happens as the embryo grows, this happens. So the brain goes one end and the majority of the gut goes down the other end. But they're still connected by what's called the vagus nerve. Now, because they develop from the same clump of tissue, they share very similar neurotransmitters, and that's like little sort of hormones that communicate backwards and forwards, so it's bi-directional. So the gut communicates to the brain communicates to the gut. The gut has as many nerves and nerve cells as the spinal cord, which is about 100 million, okay? Which sort of gives you that bit of that insight in terms of how people will say, my gut feeling, or, the intuition sits in the gut. So there's constant communication. It's so nervous, actually, it has so many neurons and nerves that it's its own system. It's called the enteric nervous system. It's actually so intelligent that the literature calls it the mini brain or the second brain, because it's able to work independently of this brain. It doesn't need the central nervous system to work. It can work on its own. It still does what it needs to do. In terms of the central nervous system and in terms of the effects that it has on the gut actually is responsible for most of your immune system functioning. And that's something that a lot of people don't know. It's also responsible in the central, with the communication of the central nervous system in terms of regulating inflammation in the body as well, and especially in the gut. What a lot of people don't know, though, also about the gut and the magic of the gut is that, who knows about serotonin? Yeah? Most of you, great. Because serotonin is that hormone that's responsible for us feeling good. And that's what a lot of the antidepressant medication that doctors will give people do. It keeps the serotonin in the brain a little bit longer so we feel happier. What a lot of people don't know is that 90% of the serotonin is found in the gut, as opposed to anywhere else in the body, and that includes the brain. Stress. We all experience it. It's defined as a psychological and physical response of the body that occurs whenever we must adapt to changing environments. And there can be positive stress or eustress, and that's when we're motivated to do something. We need stress in our lives, otherwise we wouldn't get out of bed. But then there's the opposite, and that's distress. And distress is where we find it very difficult to adapt to changing conditions. We've evolved as humans, and we've learned so much because of our ability to adapt to our environment, and that's why we've survived for as long as we have, as in terms of from an environmental perspective anyway. Now, stress, when it's acute, meaning short term, it's not so much of a problem. Actually, our body works really well when we're under very short bursts of acute stress. It becomes a problem when it becomes chronic, ongoing, time and time again, where it affects our ability to cope, but it also affects our body. Okay? So it has a huge effect on every aspect of our body. It releases the stress hormones, and I'll talk more about that in terms of the digestive tract. But it's actually been found as well, in terms of stress, to delay wound healing, which is what a lot of people don't know. And they did this study with carers with Alzheimer's disease, because it is such a tragic and horrible disease that there's quite a long period of chronic stress. And they found that actually in the study that it actually the healing took longer in those people that were chronically stressed, which sort of makes you think that, you know, why aren't surgeons sort of that are going for surgery sort of looking at the psychological aspect, considering that it affects wound healing and healing in general. The other thing they found too, just very quickly, was that if you're chronically stressed, you're more susceptible to the common cold. Okay? We all know that, right? We're stressed, we go on holiday, bang, we get a cold. Okay? So stress and this, which is sort of that inability to adapt, is that sort of contributes anyway to the common cold. I mean, you're going to need to have that bug that sort of you get as well, that makes you more susceptible. So let's look at stress. Now stress, and some of you might know this, fight-flight. Stress results in a fight-flight response. Fight-flight is a psychophysiological response to a perceived threat. So what that means is a mind-body response to something that we perceive or think about or see as threatening. And it can be a physical danger, or it can be one where we're threatened by what people might think about us. You know, I'm doing a presentation in front of 100 people, will they like it? Right? That type of stress. Now what happens is the brain sends a signal to the adrenal glands instantaneously, and your body's flooded with adrenaline. Now what happens in that response is your blood vessels dilate in your major muscles because you need to run from the threat. For example, if a tiger walked into this room, I would need to run quite quickly, right? I would need to run, I would need that energy to run. And so what would happen is that my blood vessels would dilate. My heart would pound a lot harder because I need to get more blood down into the major muscles. My body would heat up, so I'd need to cool down, and that's why we sweat when we're really anxious or when we're really frightened. Our breathing changes. We sort of, we sigh because we need more oxygen. What also happens is when we're really stressed or when we perceive a threat, we're not able to think rationally. We can't problem solve, we can't be creative because we're not meant to. We're meant to run away. And if we can't run away, what do? We fight, absolutely. If we feel like we're threatened or we can't do anything, then we attack, which is what you see these days as well in people with road rage. They're working themselves up in the car, they feel like they're threatened because they might not make it, and they feel like everyone's doing this to them, and so they yell and they get angry. That's that fight part of that fight-flight response. Okay? But it also does other things as well. It actually affects your digestive tract. It actually has a great impact on your digestive tract. okay, on your gut. I'll refer to it as gut. Now, what we've found in terms of with the stress and the gut is that there's reduced barrier function. And what that means is that the barrier in our digestive tract, in terms of the colon, etc., and it makes it more susceptible to bugs. Okay, so bugs can get through the wall. It's like the mesh, in a mesh sort of experience, the mesh becomes greater, the holes are bigger, so things can get through. But it's called increased permeability. The other thing that a lot of people might have experienced but not known why is that there's a hormone that's released, as of many, but it's called CRF, or corticotropin releasing factor. And what this does is, what it mainly does is that it delays gastric emptying. So in other words, food doesn't go down, it sort of stops, and it makes you actually want to feel like you're throwing up or having that nausea. But what it also does is that it increases the gut motility. What gut motility is the contractions in your gut. So people that might be experiencing chronic stress might have diarrhea, okay, or watery stools, or that urgency or that cramping to go to the toilet. That happens mainly because of that hormone, okay? That's why when we are stressed, it affects our gut. We might feel a bit of discomfort, we might have a different change in bowel habit. The other thing is that it makes your intestinal wall and your intestines more sensitive as well. So you'll experience pain and discomfort. What they've also found in some of the studies in terms of with inflammatory bowel disease, and I'll talk more about that, is that stress actually increased the likelihood of a relapse by increasing the inflammation in the gut. So we're talking about something that they consider to be an autoimmune disease that's not in the control of a person or the sufferer. Stress actually makes it worse and has an increased chance of bringing it on, 50% more likely. Colitis is actually the ulcerative colitis, which I'll talk a little bit about in a moment. So these are the common gut problems which I'm sure most of you are familiar with. Inflammatory bowel disease is basically Crohn's disease or ulcerative colitis. They're the main two. Crohn's disease is an inflammation of the bowel wall, from anywhere from the mouth all the way down to the rectum. Ulcerative colitis is just confined to the large intestine or the colon. Okay. Now the symptoms of this are diarrhea, pain, fever, sometimes obstruction, nausea, vomiting, and bleeding. And it can lead to actually some really severe complications, and you know, the drugs and the medication that are involved are quite as damaging and hurtful as the actual disease itself at times. And surgery sometimes is needed. Irritable bowel syndrome, IBS. Yeah, everyone's heard of that? Yeah. You see it on commercials, IBS support and probiotics, etc., etc. Now, IBS is considered to be a functional gut disorder. And what that means is they don't know exactly what's going on. It's a diagnosis based on symptomatology and the exclusion of any pathology. They can't find anything wrong. It's like the mechanics of the gut just aren't working. The functioning of it's just not working as appropriately. It has the very same, it actually has the same symptoms as people that have inflammatory bowel disease. So when a client comes to me, they usually come to me after going through many, many tests, and that to exclude any pathology such as inflammatory bowel disease. And I'll talk a bit more in terms of the stress that people have with IBS. I think in one study I read about 25% of patients that go see their GPs because of IBS or gut problems. Okay, it's the second leading cause of abstinence from work, second to the common cold. Okay, so it actually has a huge impact on people's quality of life, and I'll give you a bit more of an understanding in what ways. There's another one here that's not so common, and it's something that is coming to my attention more and more the more of the work that I do. It's called parcoparesis, or shy bowel. And this is a really interesting one because the psychological component is the big component to it. And what it is actually, the term only came about in 2003. Before that it wasn't really well researched, and it still isn't. And it's actually people that are embarrassed about going to the toilet, to a public toilet, out of fear that to open their bowels in terms of because they're afraid that they're going to be heard, or people are going to know what they're doing. And it's an underlying problem that is quite debilitating for a lot of people. One of my clients, for example, used to wake up 3 hours before going to work to make sure that she emptied her bowels as many times as she could before she went to work, so she didn't have to do it at work. 3 hours. So it can be quite a debilitating problem. People leave work, have to run outside, find a toilet when no one's around. It's quite a problem that a lot of people aren't even aware of it. So these are some of the things that we're dealing with. I mean, we're talking about the gut. And this can apply to any other illness. However, with the gut, and especially things like inflammatory bowel disease and these symptoms, it has the biggest impact in quality of life, more so than most other chronic illnesses, because of these reasons. You have to deal with the symptoms in public. You have anxiety about not finding toilets in time. You know, a lot of people that have these problems, whether it's IBS or whether it's inflammatory bowel disease, that have diarrhea will avoid going out to public places. So their social life diminishes, the quality of life. I mean, can you imagine if you stopped and you couldn't go out and do what you want to do, catch up with friends and family, because what if there's no toilet? And people are ashamed to go to friends' houses because they're worried that, you know, what if I make the toilet smell and so forth. So there's a lot of anxiety associated with it. There's a lot of planning, there's a lot of anxiety about being a burden on others, not being able to go to school or to spend time with friends, as I mentioned, not being able to have a relationship. There's decreased energy, and there's the pain, which is a huge component to affecting a person's quality of life. I thought I'd give you an example of what someone who, and I don't know if there's anyone in the audience that has this condition, and there's varying degrees of severity. This is a young girl who was a client who had Crohn's disease, and she was a very intelligent girl. She was in from the country studying law at Melbourne University. Okay, this was a few years ago, so I'm not giving away any identifiable things. Now her symptoms were diarrhea, pain, vomiting. Okay, there was some bleeding as well. And she had some complications, and what the complications were, this is how horrible the disease can be. She actually had a fistula, which is a connecting tube connecting her bowel to a bladder. Okay, now I don't need to tell you, I'm not going to tell you what sort of effect that can have on a person's sense of self in terms of how they see themselves. It's quite a disgusting issue. And so the impact that had, she couldn't go to school, she couldn't learn, she couldn't spend time with friends. She actually had to move back into the country with her parents. So she lost a lot of social contact, and as a result, she became depressed. She felt like she had no control over her life. She became helpless and hopeless. Okay. So conventional treatment for her was drug therapy. And luckily, the doctors and the gastroenterologists that saw her knew about the service that we provided, and so referred. And so that was sort of dealt with, because surgery was going to be the option for her as well as drug treatment. So again, why do people with GI problems have psychological problems? And that's because that it affects their quality of life. It affects, you have the symptoms of the pain, and etc. You have the emotional symptoms, you feel depressed, you can't control it. Because another thing I didn't mention earlier is what we're finding now in the research, which is really interesting, is that not only does the brain affect the gut affects the brain as well. Okay? And what they're finding is that 90% of the information that goes between the vagus nerve up and down goes from the gut up to the brain. Some recent studies this year actually have found that the gut bacteria, the microbiota, which is what you see in terms of the probiotics, actually influence your cognitive functioning, your thinking, your memory. We're talking about bacteria, okay? So it's sort of exciting new sort of things that we're learning about now in terms of the importance of the gut, which most people don't know about. Okay? So this is why it does have such a big effect on psychological aspects of things. Now this is just a bit of a diagram. Anxiety and depression, again, in patients with IBD were 50% higher than other chronic illness. And the main reason was that, as I said in the previous slide, it affects their quality of life more so. It's a taboo subject, you can't share it with friends. It's very difficult to share it with friends and family. But anxiety and depression. Now I'm not going to go through these in great detail, but these are some of the common psychological problems. Generalized anxiety, which is worrying, a lot of worrying, general feeling of just anxiousness and anxiety. Panic disorder, where you're having that panic attack, where everything contracts and you think you sort of feel like you're going to have a bit of a heart, something's wrong with your heart, and you become so fearful that you just can't think. Hypochondriasis is health anxiety. People that have got gut problems, especially IBS, are convinced that there's a pathology wrong with them. And so they keep going to the doctor over and over thinking that there's got to be something wrong with them. And so they get anxious, they go to the doctor reassures them, their anxiety reduces. Then they think, oh no, but what if they've got it wrong? So they run back to the doctor, they get it checked, and that's sort of that health anxiety. They're anxious about their health. Social anxiety, again, people can be anxious about going out and spending time with family and friends because they might feel anxious, what if? And then of course there's depression, and depression results from feeling helpless and hopeless. So in terms of, I'm going to talk to you now in terms of what I do and the way I work with people, and some of the different treatments that are available in terms of from the psychological aspect. Because you've got to bear in mind, might be thinking, and as a lot of people do when I tell them what I do, they think, what's psychology got to do with the gut? Actually, when clients are referred to me by gastroenterologists, they think, they walk in, they say, I'm not making this up. This isn't all in my head. And what I say to them, no, it's not. We don't know what's causing this. But we certainly know that this affects this. So if you're really stressed about what you're going through, then it's affecting your gut. It's making things worse. Our body believes every word we say and every thought we have. It just does. Okay? If we have anxious thoughts, we go into fight flight. If we're thinking about something that's coming up that we don't want to go to, it's going to affect our body. We might sigh, our heart might race a bit more. But if I gave you an example in terms of how the mind affects the gut, I'd say, okay, I want you to now just spend a minute, just imagine cutting a lemon and biting on that lemon. Just really imagine the sort of that sourness in your mouth. Some of you, or if not all of you, some are cringing, going, Your salivary glands are secreting saliva in response to that. There's no lemon. We're just imagining a lemon. Okay? So that's a sort of a more obvious example of how the brain affects the gut, but also affects the body. Chronic stress over a long period of time obviously has a greater effect on the body. And there's still a lot more research that needs to be done in this area. So when I'm working with people, I'm working with the mind. Okay? And this does influence the gut. And I'll give you more examples of how amazing this can be. So let's begin with one of the sort of most common therapies, which is cognitive behavioural therapy. How many of you heard of CBT? Wonderful, so it is great, because it is such a well-researched sort of psychological treatment. And it's not for everyone, not everyone likes it, but essentially what it involves is that it involves challenging patterns and beliefs and replacing errors in thinking. It's about noticing those negative thoughts and then replacing them with something that's more rational, because negative thoughts aren't rational. Actually, most of the time they're not even accurate. Okay? And this leads obviously to change in mood and behaviour, and I'll explain to that in a bit more detail now. Now this is what we call a CBT model, and what I'm showing you now is how we work actually in response to threat. I'm going to use the example of, let's use the example of Sue. Sue was the young lady who had the gut problems. Now, she was even when there was no problem, even though when her condition improved, she still felt anxious about going out. Because what if I have diarrhea? What if I'm in the nightclub or out with friends and I have to run to the toilet and there's no toilet? So the event for her would be going out. Her immediate thought would be, what if I don't make it to the toilet? This would result in a feeling of fight-flight, because it's a threat. Your anxiety levels go up, her heart would be pounding. She would be thinking, oh no, it's a possibility because I'm feeling it, I'm feeling something. Without the feeling, a thought is just a thought. But when we associate it with a feeling, then it gives it meaning. Okay? So this reinforces the thought and says, yeah, it's real, it's accurate. And this leads to a behaviour. For Sue, it's, I'm not going out. Remember how I said fight, flight? Can anyone guess which aspect of fight, flight she was doing? That's right. She was avoiding. She was avoiding going out. She wasn't going to go out because the feelings had confirmed the thoughts. So I'm not going to go out because this might happen. So she's gone from thinking, oh, I'm going to go out. No, I'm not going to go because I feel anxious. And her anxiety level is going to drop because there's not going to be a threat because she's not going to go. So this results in a reduction in that anxiety momentarily. But this also confirms the belief or the thoughts. Yeah. If I feel anxious about thinking about going and I don't go and I feel better, well then that's common sense really, isn't it? But it's not. It's not necessarily accurate. And so CBT does is that it challenges the thought. Notice the thought. What's the evidence? So what if, is this a helpful way of thinking? And then replacing it with more optimistic or more rational thoughts. And that would be, in case of Sue, it would be, okay, I might go out, this might happen. But it hasn't really happened in a long time. But maybe I'll pick a place where there is a toilet, and maybe I'll take some Imodium with me, for example. And Imodium obviously is that anti-diarrheal medication. So she can go out, and she can overcome that fear of whatever might happen. And if she goes out, she says that nothing happens, then she's replaced that incorrect belief that she couldn't do it. Now these are behavioural strategies. This is the cognitive behavioural aspect of CBT. And what it does is that it works on the behaviour of the person. For example, one of the part of the treatment would be getting this client or getting these clients, asking them to go out. So if they're afraid of going out, it is about behaving the opposite way to what they want to do. Essentially, the behavioural component of it is face your fears. Okay? Face your fears, and this is called exposure or behavioural experiments. Why don't we just try and go out, see what happens, come back and let's have a think about it, let's have a talk about it. How'd you go? Oh, well, yeah, it was okay. Great. Go again and go again until you no longer feel that anxiety. Because anxiety goes up, it plateaus, and it drops with everyone. Anxiety is never going up. It's never going to continue to keep going up. It always plateaus. It might be a bit bumpy, but it always drops. And so if you keep doing the thing that you're afraid of, right, you won't become afraid of it as much anymore, if at all, because you're facing your fears. And that's really a big component to overcoming anxiety in general. Okay? And there's obviously problem solving. And relaxation is another way of changing the emotional aspect of it. Because when we're really anxious, our overall stress levels, let's say, or arousal levels are really high. So by relaxing the body, we can think rationally. Because remember, in fight, flight, we're not thinking rationally. We don't need to. If there's a danger, we run or we fight. So some of these might be breathing exercises. Just slowly taking a breath in. Your body needs oxygen during stress. Very simple. 5 slow, deep breaths all the way in and all the way out. And this will make a difference. It might not get rid of the anxiety altogether, but it will reduce those anxiety levels, okay, to make things a bit more manageable. And there are some other relaxation strategies, and there are some, progressive muscle relaxation, which is contracting and relaxing the muscles. And you can get all this information actually on YouTube. Okay? There are CDs and so forth, but there's a lot of free stuff on the internet of different exercises. Visual imagery, exercises where you imagine being on a beach, relaxing on the beach. That's if you like the beach. Or going for a walk in nature. And what you're doing is you're doing 2 things. You're not thinking about the threat. You're distracting yourself. You're refocusing your attention. So you're giving your body that opportunity to just to settle itself down. Okay? And you're also thinking about something lovely, which will be bringing out more of those happy hormones, I guess, if you can look at it from that perspective. And there's mindfulness and meditation. Now, I don't know if Deborah's done some work. I know she does a lot of work with mindfulness, so she's the expert in that area. And again, it is about, and meditation, it is about being in the present moment. It's about being here. Not being about, thinking about tomorrow or yesterday. That's where stress lies. Here and now, there's just here and now. I don't know if anyone's seen Kung Fu Panda. It's one of my favourite movies, but the turtle, right? The turtle says tomorrow is a mystery. Yesterday's history. Tomorrow's a mystery. No, today's a gift. That's why they call it the present. Yep, that's right. Absolutely, absolutely, and it is. It is. Most of our stress comes from what ifs and what have I done in terms of consequences. Okay, so meditation is also, not only that, it's also a way of you noticing and observing that a thought is just a thought. That's all it is. It's a little signal that's going on in your mind. Thoughts are powerful, and sometimes they're very useful. Well, most of the time they're useful, but a lot of times they're negative. Because in terms of our survival as people over thousands of years, we've needed to be thinking a bit more negative, because otherwise we would have gotten eaten by predators. We're talking 1,000 years ago. 1,000 years ago, man was walking the earth, and we needed to survive. And so we need to be on alert. But now our anxiety has changed, and we're perceiving threat that isn't really even threatening. What will Jack think of me? Who cares? It doesn't really affect me. But if it's a threat, then I'm going to feel that anxiety. Okay? So mindfulness is that. So the ultimate aim of psychological therapy, really, whether it's CBT or whether it's mindfulness, is to stop the feedback. If I have a thought, I wonder what they're going to think of me at the party, and I don't really feel any feeling, and I don't avoid it, then it's just simply a thought. Okay? So it's to stop that feedback going backwards and forwards. Now mindfulness or acceptance-based therapy, or ACT as it is now, which is it's sort of a bit of a newish, not new in terms of the last 2 years, been going on for some time now, and it's a different way of looking at psychological treatment. So instead of people trying to resist or challenge their thoughts and saying, no, you're not like this, no, stop, go away thought and so forth, mindfulness just says, okay, I'm having this thought, I'm going to bring it back to my breathing, or I'm going to bring it back to the present moment. And I'm going to give my body that time for the anxiety level to drop. Okay? So that's the aim. That's the same with acceptance. So let me give an example of acceptance. Acceptance is, let's use the example of Sue. Oh, what if I go to this party and I have to go to the toilet? What Sue would do then is, I'm having a thought that if I go to this party I might not find the toilet. Thank you, mind. So what it's doing is Sue's saying, this is not me. This is a thought that I'm having. I am not my thoughts. And that's what mindfulness is. Okay. Now, this is an area that I spend a lot of time doing, and it's called gut-focused hypnotherapy. Gut-focused hypnotherapy was developed over 20 years ago, actually, by a professor of gastroenterology in Manchester, in the United Kingdom. And at the time, he was treating people who had irritable bowel syndrome. And he was finding that conventional medicine just wasn't really useful, wasn't very helpful. And he had an interest in hypnotherapy, so I thought, maybe I can do something. He's really a lovely man. Maybe I can do something to help with my patient's suffering. And so he tried it, and the majority of patients improved. He was quite surprised. So he set up some research, and he found again, the majority of patients improved, not only in symptom reduction, but also in overall quality of life and psychological well-being. There was a reduction in depression, there was a reduction in anxiety. People were able to go back to work a lot sooner than what they could before. So what he noticed in the study was, again, about 70 to 80%, and this research has been replicated all around the world, not only in Manchester, and the results come back almost identical. Okay, so what it does is it aims to reduce the physical and emotional pain and improve the quality of life. And it's a hypnotherapy treatment. And hypnotherapy, I know many people have had hypnotherapy, it's not about losing control or getting people to run around like chickens and things like that. It doesn't work. I've never tried it, to tell you the truth, because it's just not ethical to try it. But if it was that easy, I think there'd be a lot more people doing it and misusing it. But at no point are you not aware. But it's quite an effective treatment in terms of managing and even reducing. What they found actually in clinical trials is they found that it reduced the sensitivity of the intestines. This is the medical research. They found that it reduced pain and improved quality of life. Okay. Actually, they didn't change motility. So people that were diarrhea predominant, it prevented the diarrhea, and the people that were constipated, it increased that movement. So they sort of were able to sort of get back into that normal zone again. Okay. There's actually been some research, not much unfortunately, looking at it with inflammatory bowel disease. And what they found is that it actually reduces the inflammatory markers, the inflammation in the bowel. Unfortunately, not much research has gone into it. There's only been 3 studies. The reason being is that hypnotherapy is not drug-funded research. And so it's very costly to do research that's not funded by a drug company. And the drugs do tend to work quite well for inflammatory bowel disease especially. But again, it's one of those things. It's very similar to complementary medicine, really. I mean, there's so many wonderful things that come out of complementary medicine, but it's very difficult to get funding for the research. And I think that's with nearly every modality of complementary medicine. So now what I'm going to do is I'm going to talk a little bit about stress management and coping. And I've chosen this particular slide because I tried to find something that symbolises environment. Now, environmental factors are really important to everything about how we behave, how we think, and how our body, and our cells of our body, and even our genes work. Okay. What they've found is that the outside environment, now the environment includes the physical environment, it includes diet, it includes social support and networks, it includes your thoughts. And what they've found, and there's a professor called Bruce Lipton. He's got a wonderful book called, you've read it, great. And he's actually a sort of microbiologist and lecturer and so forth, and he's written a book called Beyond Belief. And it's an incredibly interesting book because what he looks at, he says, we think about genes and we think about DNA and all that being the determinant factor to the way our cells behave. Well, he actually was interested and he removed the DNA of each cell to see what would happen. And the cell continued to do what it was meant to do without the brains. So his theory was, it's actually not necessarily the result of the DNA, it's the environment and the membrane and the communication between the two. What we've also found is that DNA, in terms of genes, can be switched on and switched off by environment. Okay, that's the body perspective. What we also know from the psychological perspective is that the people that you spend time with also influences your body. A recent study coming up last year, I don't know if most people have heard, if you spend time with people that are a lot of time with people who are obese, then you're increasing your likelihood of also becoming obese. You're influenced by their behaviour. So our environment plays a big factor in who we are physically, in terms of stress levels as well, but also emotionally and mentally, cognitively. So let's look at some of the environmental factors that you might be able to walk away with today that will be useful for you perhaps. And some of these you might already know, some you might not, or some you might have forgotten. Meditation, right? Meditation is, I think, one of the most important things that a person can do personally. I think if everyone had to meditate at school from a very young age, I think the world would be a completely different place. But what they've found, I mean, in terms of the gut, there hasn't been that much research looking at meditation or mindfulness on the gut, unfortunately. It's in progress at the moment, actually, to see what sort of effect that it has on the body. But what they have found as well is that it may slow genetic aging and slowing the rate of cellular aging. Wouldn't that be good? It's cheaper than Botox. It just takes a bit more time. Exercise. Exercise is another one of those behavioural experiences. And it does many different things. As you can see, they're out in the physical environment. They're not sitting behind their desk. We are humans that have been walking the earth, for thousands of years, right? And in the last 100, maybe 200 years, less than that actually, we're driving around. We're catching public transport. We're sitting in our desk. We're not doing exercise. We need to. Actually, research is now showing, and there are some studies going on where people are taking in treadmills into their work, and they're sitting on the computer, and they're working on their computer. No, really, they are. And what they're finding is that by walking, they're clearing their thinking. And even if they're stressed, remember, adrenaline is going through the body. What's adrenaline? Adrenaline what makes you run. So you're burning off that excess energy while you're walking. I haven't tried it. I think my clients will find it a bit unusual. So how are you feeling today? No, I'm not going anywhere. I'm right here. So, but what it's been found to improve mood. Okay, I mean, I could show you many different point forms in terms of what it does for the physical body. It reduces tension, anger, fatigue, and confusion. Again, influences cognitive functioning. Decreases anxiety. Postnatal depression. This was a study that was done not long ago, and what they did is they recruited women that had postnatal depression for their first child, and they were again pregnant. So what they got these ladies to do, it was to exercise. That was it. Just exercise every day, just go for walks. I think it was like a 20-30 minute walk every day. And they found that the people that exercised compared to the ones that didn't had less anxiety, less depression than the ones that didn't. This was just from exercising. Just from exercising. And as you can see there, that you can do it alone, you can do it with others. But how many of you have noticed when you go for a walk, your thinking's clearer? Just things like, oh, wow, that sort of came to me now. I didn't realise that was, I found an answer to the problem. Social support. I actually took that photo outside of Safeway. I was looking at these two dogs and one just started to sit on the other and I thought, wow, look at that. How's that for support? Huh? You can sit on me, that's fine. It's all good. It's kind of warm. It's a cold day, so it's fine. Social support is really important. Okay, we're humans. We also physically have survived for as long as we have because of our ability to build communities and work together. In the animal kingdom, the animal that doesn't have that pact has a reduced chance of survival. That's why the pact is so important. That's why communities are so important. That's why, realistically, that's why this is important, why you're here. Not in terms of here, listening to me, but just being here, working together, talking. It's vital to our survival. This survival and physical survival. And even body and health. So again, what they found with social support, again, improved mood, reduction in anxiety, and I've got improved mood there twice, but also beneficial to the body as well. Because when we're anxious and when we're depressed, what do? We go into fight-flight, right? So we withdraw. If I'm feeling sad and I think I'm no good and I'm hopeless and I withdraw and I don't talk to anyone, well, I'm only spending time with myself in my own head. And if I'm talking to myself saying the same things over and over, I'm going to believe it, aren't I? I'm worthless, I'm hopeless. Whereas if you're sharing with people, I'm just feeling really anxious, Jack. Oh, that's okay, I felt like that too. This is what I found that's helped. Or just sharing it and releasing some of that anxiety or that angst is vital. It's really, really important. Spirituality and religion, also vital. Okay. Now, there were many studies, and I chose a couple here to sort of look at some of the physical effects. Again, no research has been done to look at the influence of the gut, but I don't think it would be any different. Remember, stress affects the gastrointestinal tract, so this is no different. And what they found was, which I was surprised about the second point, there was lower blood pressure, which I thought, yep, this lower stress, that's fine, stress can raise blood pressure. But there was actually an improvement in cholesterol levels, which I thought was really interesting. So it's not necessarily just about what you eat, although it might be as well. Better immune function, reduced onset of physical and mental illness, reduced mortality, increased likelihood of recovery from physical and mental illness. Okay? And the way they found this was by, in terms of this interaction, in sense of community again, in this belief system, that it increased healthy behaviours, there was that social support again, there was a sense of coherence and meaning. When there's a sense of meaning and you feel like you're not alone, then you feel more at ease. You feel connected. Connected to yourself, connected to each other, connected to God. It's very important. This is not petrol. Okay? So I'm not saying to fill up, although I do need to fill up. How well your body works depends on the quality of fuel you give it. If you put whatever in your car, it'll run. But you're increasing the likelihood of how long will it run for? How well will it run? So diet is another one of those environmental factors. And that's also important, eating healthy. In terms of gut problems, there are people that can't eat, people that have celiac disease can't eat gluten. There's even some other diets out there called the FODMAPs diet, which is people that have fructose and lactose and fructose intolerance. Okay. So diet is another component because it affects your thinking as well. It affects your body. So what I'm going to ask you to do for like 3 more minutes or a couple of minutes, I want you to, to partner next to you, just spend a couple of minutes and just have a bit of a discussion about what you think, or what other environmental factors you've found useful, that's been helpful for you, whether it's managing your health, whether it's managing your anxiety, whether it's managing whatever. Just spend a minute or two just having a bit of a discussion with each other, just find a partner, and I just want you to sort of discuss what sort of things have you found useful. Can you do that for me just for a minute? Okay. Great, sounds like there's a lot to talk about. All right. Who wants to tell me what some other sort of environmental factors that I didn't perhaps mention up there on the board that I want to share? Yeah. The arts, creativity, absolutely. Anyone else? Laughter, yoga. I didn't mention yoga, but you're absolutely right. Yoga is also very. Laughter is very important. Laughter yoga. I didn't know that was laughter yoga. Great. Really? Okay, I might have to come to that. Yep. Yep, with someone back there, yep.
Myself?
Yep.
Oh, me, okay. Caring for birds. I care for birds.
You care for birds?
Birds are displaced or wildlife, our wildlife in the district. I set up aviaries in my garden when I retired, I care for them.
So
it's just opened up a whole new avenue. It's just such a beautiful thing to be involved.
So there's 2 things in there, sense of purpose, helping, and pets as well, which is, or the animals, which also.
I respect that they are wildlife, so
yep.
they get released.
Not pets, but yeah. One more.
Playing music.
Playing music, absolutely. So, I mean, what else did you get from this little exercise? Yeah. Sharing. We might not know that our fellow person next to us, friend, anyone, might be able to offer you suggestions. Because there's always more than one way. Okay? So the ultimate aim of I guess, everything that you're doing here, that Deborah does and everyone does, is so we can leap up in the air with a ribbon. Okay. That pretty much in terms of concludes my talk. So, thank you very much for being a great audience and listening. And if you like, I can. What about the summary? I can answer any questions that you might have about anything that I've discussed. Do you want to pass the mic or?